Now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, hello and welcome to Boomer Life here on CIL 650. I'm Sterling Fox, and on this episode of the program, we're joined by one of the professional team from Falls Creek Healthcare Center in Vancouver, focusing on your health, and we're delighted to welcome Dr. Chris Coburn to the program. Dr. Coburn is a laparoscopic surgeon. He's been one since 1991. He's been focusing his time and practice on advanced laparoscopic surgery. We're talking about the kind of surgery more and more of us are seeking out with respect to weight loss. Dr. Coburn, welcome to Boomer Life, sir.
Thank you very much. Good to be here.
It's good to have you with us.
You.
This is, Raul, here we are, just a little over a week into 2015, deep in the heart of resolution season.
Exactly.
So this is the time of year, perhaps, at which more of us contemplate changes in our lives. And a lot of us are going, well, geez, it'd be nice to be looking good in a bathing suit by July 1st this year.
Absolutely. And there are options. Obviously, people who are interested in weight loss have options. The traditional options being diet and exercise, and we can talk about the effectiveness and for whom those make sense.
Sure.
But certainly our experience at SmartShape is dealing with individuals who have a significant amount of weight to lose.
Okay.
Those who would be considering some of sort of weight loss or bariatric surgery.
All right. Now, you just mentioned something called SmartShape. This is an outfit of which you are the boss, the president and the CEO. What exactly is SmartShape?
So SmartShape is a clinic that began 10 years ago. Began at our center in Mississauga and has facilities across the country where we can provide a variety of weight loss options, surgical weight loss options for individuals, including the lap band procedure, the gastric sleeve, as well as the gastric balloon.
Okay.
And we joined with Centric Health a year ago now, and that gave us the ability to bring our program that was initially based in Mississauga now to facilities all across the country.
Including, of course, Falls Creek Healthcare Center right here in downtown Vancouver.
Right.
Now, how long have the folks at Falls Creek been on board with this, with your SmartShape company?
Yeah. So Falls Creek's been doing lap bands for some time.
Right.
But with the merger with us, with SmartShape, again, we've been able to bring our training, our staff, our techniques, our follow-up program, which is critical to the lap band procedure in particular.
I'll bet.
Bring that to the Vancouver and, in fact, to the BC region.
Okay. And when one goes to the Falls Creek Health Center website, Dr. Coburn, one also sees mention of Centric Health Surgical Center. What does that mean?
So Centric Health is the parent company, traded on the TSX in Toronto, that has a number of healthcare businesses, including the surgical side of things. And on the surgical side, which again is just a part of Centric, Centric has facilities in Vancouver and Calgary and Winnipeg and Mississauga and Toronto where they do a wide variety of surgical procedures, not just the weight loss operations that we do.
Of course, yeah.
But orthopedic procedures, plastic surgery, endoscopy procedures, many procedures across the country.
Okay. So now that we've got the official technical stuff out of the way, let's go back to the reality of January 10th, if you don't mind, Doc, because this is the time of year, as I mentioned moments ago, at which people actually, I mean, once the hangover wears off and the reality of a whole year ahead of me, many of us, we have the best of intentions when we try to form resolutions, but as we all learned over our lives, the road to hell is paved with good intentions.
Right.
So we decide that we're going to do something.
Right.
And I think probably, and I'm looking for your experience on this, most of us are going to try and lose weight. Is that typically the majority of wish list number ones for Canadians?
Oh, I think it certainly is. Certainly the patients we see are all those who are desiring weight loss. But we have to keep in mind that obesity is a chronic disease.
Right.
It's not something that just comes up overnight, but it does affect a significant portion of the Canadian population. About 60% of Canadians are either overweight, meaning a BMI of greater than 25, or obese. And in fact, 10% of the Canadian population, or well over 3 million people, would be candidates for the kinds of procedures that we offer at SmartShape, including the lap band, the sleeve, and the balloon. And it's a chronic disease. It's a chronic, unremitting disease.
You talked about BMI and then added a number. Can you explain what BMI means and what the number means as well?
Sure. So BMI is an acronym for Body Mass Index,
Okay.
which is a way that we use in the weight loss world of measuring the degree of being overweight or obese.
Okay.
So typically BMI 20 to 25 would be a normal weight. 25 to 30 would be considered overweight. 30 and above, various degrees of obesity. And when you get to a BMI of greater than 40, you're talking about something called morbid obesity. And the reason we use the word morbid is because it implies that there is a very high likelihood of having health issues associated with the weight. Things like diabetes,
Right.
high blood pressure, sleep apnea, high cholesterol. So it's the morbidly obese or the more severely obese patients that are generally going to be uniformly unsuccessful with the traditional methods of weight loss in those who would be considering the lap band procedure, for example.
Okay, so let's talk to two people. You know, we're talking hopefully to more than two, but let's take two specific resolution examples. One person is somewhat overweight, wants to lose maybe 15 to 20 pounds to get that bathing suit just perfect for the summertime. The other person is considerably overweight, perhaps in excess of 50 pounds overweight. What recommendations would a professional like yourself have for both of those individuals, the one with the desire to lose 10 to 15 pounds versus the one who wants to lose 50 or more?
Certainly, yeah. So the lower weight person, the 10 to 15 pounds, is somebody who in fact may benefit from an exercise program, from seeing a trainer, from going on one of the good diets. Basically, the best thing that one can be doing from a diet point of view is eliminating carbohydrates from the diet. Those
Okay.
are the things that make you hungry. It's carbohydrates that make you fat. So the person who only has a few pounds to lose may benefit from that sort of an intervention.
Okay, so there wouldn't be the need for anything
No.
with such a small amount
Right.
to achieve.
Right.
Surgery would be
No, I mean, the procedures that we do are very safe,
right.
very low risk of complications, but those patients with only 10 or 15 pounds really are not going to have the health issues that justify even a very limited amount of risk.
It's interesting that when you talked about morbidly obese, doctor, because in my mind, whenever I hear the word morbidly obese or morbidly in front of anything, I don't go into the details. I just see that adjective as meaning it can kill you.
Yeah. Yeah, certainly. We know that, and I don't like the word morbid as well. I mean, I use it, but only because it's in the scientific literature.
Sure,
but,
yeah.
But yeah, I mean, being overweight to that degree has an effect on your life. We know, for example, that a 45-year-old person with a BMI of 45, which is not that really super heavy, on average loses 15 years of life. Dies 15 years earlier than they would otherwise because of the health issues related to being that much overweight.
Is it all about the extra work the heart has to do? Is that what it's about?
Well, it's complex. I mean, when somebody is overweight like that, they have a much higher risk of diabetes.
Okay.
90% of the patients we see with type 2 diabetes are obese.
Okay.
And the diabetes combines with the high blood pressure, with the high cholesterol, and you now start to paint a picture of increased risk of cardiovascular disease. You also have a higher risk of a whole series of different cancers that are more prevalent in the obese population, but you have issues around mobility. People who don't move as well are more likely to get pneumonia. I mean, it's a cascading effect.
Right.
And the unfortunate thing is that the heavier patients get, the less likely they are to be able to lose the weight on their own. And again, that's where the surgical procedures that we do at SmartShape are so beneficial in that high BMI group.
Well, you know, I did a little homework in advance of your appearance with us, Dr. Coburn, and at your recommendation, checked out some of the names of some fairly well-known people who have undergone these surgical weight loss procedures. And one thinks of certainly the fellow most likely to be fronting the Republican Party in 2016 in the United States. That's Governor Chris Christie of New Jersey, who has gone through what one, just watching TV and watching the guy for the past year and a half, rather significant weight loss. He's still a large man, but he's half the size of what he once was.
And I suspect a great degree healthier. I mean, Governor Christie has been a great example, a public example of the benefits of the lap band procedure. Had a surgery done by a good friend of mine in New York City, and I know is doing extremely well, and his health is improving, his demeanor is improving, his ability to be mobile is improving. I think Governor Christie is extremely happy with his decision,
Well,
as are many of these
yeah,
patients.
well, he certainly looks happier.
Mhm.
Yeah, he just looks. He's got a little bounce in his step, if
Yeah.
nothing else, and
Yeah.
that generally is indicative of optimism in the person that's bouncing, isn't it?
Again, he brings out one of the important things that we've recognized at SmartShape is that weight loss for most of the patients that we see is not about the number of pounds they lose. For most patients, they want to lose weight because their weight is affecting the way they live, their mobility, their ability to go out and socialize, the way they look, the way they feel. Yes, it affects their health.
Sure.
The higher risk of diabetes and all the things we mentioned. But when we talk about success with bariatric surgery or weight loss surgery or the lap band procedure, we talk much more about what we determined or we call non-scale victories.
Okay.
The individual, and I've got lots of stories, but the people who walk in and tell you something that they can suddenly do they couldn't do before. They can paint their own toenails. They can shop in a normal sized clothing store. They can walk up a flight of stairs, ride a bike, roll around on the floor with those kids. Those are the things that are so heartwarming about what we do.
Right, right. And the things that people who are of and I hate to use the word, but normal weight in quotes, take for granted. Absolutely take. We don't even think about stuff like that.
Don't understand at all. And the obese it's amazing because obesity remains the last socially acceptable prejudice that we allow in society.
Right.
Right.
Yeah, fat jokes are still permissible.
Yeah, they are permissible. We don't make jokes about people's color or their religion or their sexual preference, but we can make jokes about their weight. And they know that. And for these individuals to be able to lose enough weight that they feel comfortable moving about in society, getting out of the house, going dancing, all the things that they've always wanted to do. Those are the heartwarming stories that make us, and make my team at SmartShape so dedicated to the work they do.
Well, Governor Christie was my first example because he's perhaps one of the better known, but he's a guy. And I'm curious as to whether males or females lead the parade when it comes, particularly during resolution season, Dr. Coburn.
Yeah.
Do more men express a desire to lose weight, or do more women?
Overwhelmingly women.
Okay.
80% of the patients that we operate on at SmartShape are women. And I think there's a number of reasons for that. One is that being overweight is more socially unacceptable for women than it is for men.
Right.
A man to be overweight is not viewed by society with the same level of prejudice, if you want. So, in fact, when men are overweight, we call them fat cats, which can be a sign of success, if anything.
True, yeah.
So certainly from a social point of view, the majority of the people we operate on are women. But interestingly, men, by the time they come to see us, are either one of two things. Either they've developed a number of these health-related issues, be it sleep apnea or diabetes, or very interestingly, younger men who have been married and now have a baby. And that becomes a trigger for them to realize that life is serious, and weighing 350 or 400 pounds is not going to be conducive to raising that child in the long term.
I was just going to say, when we had our first, I was about 30, and you're absolutely right. It transformed my life completely. I actually, for the first time ever, thought about and bought life insurance, and all of a sudden started thinking about my long-term health. Looking at this little pink person, I'm going, gee, it'd be fun to be around and walk her down the aisle in 20 or 30 years. And so you started to rethink your take on getting to all of those goals.
Again, think of the lap band or the gastric sleeve as really a form of life insurance.
Right.
I mean, it's what's going to allow individuals to lose weight and keep the weight off, which is the critical factor. It's not about gaining and losing. It's losing the weight and keeping it off and improving your health, improving your life.
So for the person trying to lose 10 to 15 pounds listening to us, the advice about diet and exercise is most likely applicable.
Correct.
So why would not diet and exercise be equally applicable to a larger person with a greater amount of weight to lose?
Hunger.
Oh.
Hunger. Hunger is the enemy of all diets. So when people lose weight on a diet, they're sticking to a program or eating a certain slate of foods that they're restricted to or whatever. And they can do that for a period of time, and they may be able to lose some weight. But your body responds to weight loss by making you feel hungry, because it feels your brain, your central system, thinks of weight loss as a threatening condition.
Okay.
It doesn't know that you're dieting. It thinks there's no food left in the forest, and if this continues, you may die. So
it's that hunter and gatherer genetic DNA,
it's there.
isn't it?
It's in there,
Yeah.
and we're much more able to put weight on than we are to take it off for that reason.
Okay.
So hunger is what drives, or is what the enemy of all diets. And you may be able to lose weight for a period of time, but the hunger gets to you, and you get happy, or you get sad, or you go on holidays, and suddenly you start to eat again. You reverse the process, and the weight comes on very quickly. What we do with all of these procedures, lap band, gastric sleeve, balloon, is we basically trick the brain into thinking you've eaten more than you have and getting rid of the hunger, controlling the hunger.
Isn't that weird? It's your brain.
Yeah.
You should be in charge, and yet you still have to trick yourself.
It's deep inside. It's way down at the most
really
primitive aspect
odd,
of the brain.
isn't it?
Yeah,
But that's what you got to do, right?
Because eating is a survival thing, right?
Sure.
You've got to eat,
right?
And when you don't, your brain feels threatened. What we do with these procedures is allow individuals to eat the same food that they normally eat,
right?
But imagine a smaller portion. So eating from, let's say, a bread plate or a dessert plate rather than the dinner plate, but the same content of food, your meat, your vegetables, your potatoes, whatever.
Right.
But being able to walk away from the table with a smaller portion and allowing the lap band or the sleeve or the balloon to give your brain the impression you've eaten much more than you have.
Right. And nutritionally, you're not doing yourself a disservice, are you?
No, with all of these procedures, again, and I suspect we'll talk about them in what they do, but all of them involve portion control, strictly portion control. Once the food passes either through the lap band, around the balloon, or down the sleeve, it goes down through the digestive tract normally. So there are no changes whatsoever to digestion or absorption. You don't need the handfuls of supplements that you do with other procedures, such as the gastric bypass. And so you eat the same food, just satisfied with less of it.
Interesting. Well, we're going to need to take a break here. And when we come back, we will go into those 3 procedures that you've described ever so briefly into some detail. And again, right here at resolution season, do we get as dramatic as some kind of surgical procedure? Perhaps. And Dr. Chris Coburn is here to at least provide information so that when you're looking at alternatives to make 2015 a better year in your life, well, at least you know about this and that possibility. Dr. Chris Coburn is a laparoscopic surgeon. He's the president and CEO of SmartShape, and he's one of the good guys at Falls Creek Healthcare Center at 555 West 8th Avenue here in Vancouver. FallsCreekHealthcare.com is the website. Check it out while we take this break on Boomer Life.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIAL 650.